when you look at the past 7 days in Oklahoma, we've had 21,308 new cases confirmed in the state and 156 deaths, which is the highest number of deaths in 1 week that have been recorded, recognizing that not all of them were actually occurred this past week. I think the other thing that I was struck by this morning was the number of cases in the United States now. More than 200,000 cases a day are being confirmed in the United States, and 2 Americans die every minute from COVID-19 right now. So the number of deaths and the number of new cases in the United States has just gone up dramatically. In Oklahoma, we've looked at maybe some encouraging news as the number of new cases reported for the past several days had dropped a bit. So far this week, the State Health Department has reported the results of 127,845 COVID-19 tests, which is a large number that included the extended weekend. Of those, just under 15% remain positive, and that number simply is not going down, which gives me great concern about the ongoing new cases that we're going to see in Oklahoma. And then finally, hospitalizations have been the big news, obviously. As of yesterday, there were 1,687 hospitalized patients in Oklahoma, with 482 patients in the intensive care unit, just under a third of the patients. 482 ICU patients with COVID-19 is the highest number we've had since the start of the pandemic. So sadly, as I've mentioned before, we're going to continue to see deaths from this disease with people that sick that require ICU level of care. I just wanted to highlight what happened in Oklahoma in November. In November, we had almost 75,000 new cases confirmed, which was 37% of all of the cases that we've had since the start of the pandemic. So we saw, very rapid community spread of the virus during the month of November. One of the questions that's come up a lot is, do children get infected in the home? Do they infect their parents or vice versa? And this particular study, relatively small, but out of 2 states, Utah and Wisconsin, showed that the rates of infection between both adults and kids in the household was almost identical, right around 30% of the people living in a household with an infected patient became infected. But the one thing they did note is the kids often don't have symptoms. And if they have symptoms, they're different than adults. So a lot of the cases simply get missed in the home. So household transmission with kids in the home is probably more common than we've thought at some point, but it's very, very important to recognize that it can occur and may occur just as often with kids as it does with adults. One of the interesting discussions that Dr. Drevitz and I and many others on this campus have been talking about is how many people in Oklahoma have had this infection. So we know from numerous infectious diseases that the number of people who get a test done and test positive is often much lower than the number of people in the community who've had the infection, but they either had no symptoms, didn't get very sick, so they never sought medical care and never got a test done. And the estimates are all over the map on how many people that might be. But the one that caught my attention was a study that was a bit more recent, a modeling study that came out from the CDC that's in press right now, and they suggested that for every 1 infected person, there may be between 7 and 8 people in the community that were infected, didn't have symptoms, didn't get a test done, didn't seek medical care. And so again, the estimates vary widely, but it has real significance when you start thinking about how rapidly the disease spreads if you have a substantial proportion of your population that's already had the infection.